Welcome to the Diana Wellbeing Conference, and I have the pleasure of introducing Professor Silvia Martin. So, Professor Martin is Professor of Epidemiology, Mailman School of Public Health, Columbia University. Ms. Martin has served as the Director of the Substance Use Epidemiology Unit, Director of Columbia's Policy and Health Initiatives in Opioids and Other Substances, and co-director of the NIDA-funded T32 Substance Abuse Epidemiology Treaty Program. She has co-authored over 220 peer-reviewed publications, most of them from former mentees or current mentees, and her research focuses on prescription opioid and heroin overdoses, as well as cannabis, other substances, and psychiatric disorders in adults and children in the U.S. and Brazil. Professor Martin has received several awards for her research and mentoring, including the 2021 Columbia University Mentoring Award. She is a faculty member of Columbia University, and she also is part of the Guyana Research in Trauma Injury and Trauma Training Program for GROT. There you go.
Can you see my screen?
Yeah.
Okay, so thank you for inviting me to talk today. And I do a lot of research in the US, but I also have some projects in Latin America, more specifically in Brazil, and I've had projects in the Southern Cone. And it's my pleasure today to talk to you. I thought it would be interesting for this audience to hear a little bit about our work in Brazil. And so I'm going to talk today about trends in drug overdose deaths in Brazil between 2000 and 2018, socio-demographic characteristics of the decedents, intentionality, and an ecological analysis by region of the country and country borders. And this is work that was funded by a Columbia President's Global Innovation Fund, and it's a partnership between Columbia University, Federal University of São Paulo in Brazil, and also researchers in Colombia. So as you all know, drug use is on the rise in the Americas, and one of the most populous countries in the region. One of the most populous countries in the region is Brazil, with 214 million people. And the patterns of drug use and overdose can vary a lot between countries in the Americas. And drug use and drug use disorders are a major public health problem in Brazil, but to date, little was known about trends in fatal overdoses. So what I'm going to present today are some results from papers led by members of our research team, trying to shed some light to this data that is not yet available in peer-reviewed papers. So the first paper that I'm going to present to you today was led by Marina Bianco, who is a medical student at the Federal University of São Paulo. And in this paper, we wanted to look at the patterns and trends in drug overdose deaths in Brazil and bring awareness to the gaps in Brazilian mortality information registers. So what we did is we got access to data from the mortality information system called SIM-DataSUS for Brazil from 2000 to 2018, and we restricted our analysis to all those deaths ages 10 and older, and we excluded those who didn't have exact age. Our total sample size for this study was of 18,444 decedents. We looked at the characteristics. We look at the characteristics of people that died from overdoses. So we looked at age, sex, level of education, race, marital status, whether they had gone through an autopsy, what was the manner, the mode of death, whether it was accidental, a suicide, homicide, unknown, or natural or missing. We also had codes for intentionality, and we also examined whether there was a T code in the death certificate. So we looked specifically at the ICD-10 codes, like on unintentional overdose, intentional overdose, and undetermined intent. So what we did is, like, for this initial paper, like, we just computed summary statistics for each of the exposure, for each of the social demographic exposures, and we estimated the mean and standard deviation for the continuous variable of age, and percentages for all other categorical exposure variables, followed by joint point regression analysis used to assess whether there were significant changes in trends in drug overdose over time. And joint point analysis fits a trend curve in a regression model that can describe the data as parsimoniously as possible. It fits joint point to the curve to show if there are significantly different trend lines. Yeah. So what were some of our findings that are currently under review? Yeah. So I know this table has a lot of information, but I just wanted to show you here that among people that died by an overdose from alcohol or drugs during this time period in Brazil, the mean age was 38. Most of them were men, self-identified as men, about 62%. This education distribution was more or less distributed evenly with more than 25% of them having completed high school, and almost 30% of them having completed some college, but there was a lot of missing data. Most of the decedents were identified by the medical officers as non-white, more than 50% of them. As in data from other countries, almost 60% of them were single at the time of death. Only a little bit more than 50% of the deaths by overdoses, in only about 50% there was an autopsy. 30% of the deaths were considered accidental deaths. Almost 37% of them were considered as categorized as suicide, and about 40% of them were considered unintentional deaths, even though, like, we have still a large proportion of deaths that were determined to be either intentional or unintentional. And most importantly, what we think is something that needs to be improved in the data system is that almost more than 77% of these deaths, of these overdose deaths, didn't include a T code. The most common drug, so we don't know, like, which drugs were involved in these overdoses for sure. But of those that had a T code, the most common drug for overdoses in Brazil, different like from the US or Canada is cocaine, that happened in more than 40% of cases, then followed by alcohol in 22% of cases that had a T code, and then benzos in about 12% of cases. So for this in preliminary paper, I'm just going to show you a few of our trend regression models. We have way more in the paper that is currently under review. So we looked. I'm going to show like some specific trends over time. So in this figure, we looked at the trends over time in the percentage of people, of non-white decedents that died by drug overdose in this time period. And what we see here clearly from this graph is that we see three different joint points. We see a significant increase in deaths in this subpopulation from 2000 to 2004, then a non-significant decrease between 2004 and 2007, followed by a significant steep increase from 2007 to 2014, and then it remains relatively flat up until 2018. When we looked specifically, because most of the deaths happened among people that had completed high school or had some college, what we see is an increasing trend of drug overdose among decedents that had some college level or higher educational attainment. And we see a consistent increase in overdose deaths in this population in Brazil. Then we wanted to look also whether there were different trends between those overdose deaths classified as intentional or unintentional. And when we looked specifically at those classified as intentional deaths, we identified a decreasing trend in intentional overdose deaths throughout the period, and we identified two different joint points. First, a non-significant decrease up until 2008, and then a significant decrease between 2009 and 2013. the pattern was different for those overdose deaths classified as unintentional. We also identified two joint points in 2008 and 2015. But we initially saw a non-significant yearly change of 10% between 2000 and 2008, and the significant yearly increase in deaths, overdose deaths classified as unintentional from 2000 to 2008, and then between 2008 and 15, a significant yearly decrease. And as I mentioned before, the leading drug involved in these overdoses was cocaine and crack. Then I'd like to show you a little bit more detailed data, which I also think is interesting for this audience. Like we had access to data. We had access to data by regions of the country, and also by whether they were close, like to the borders of the country, so the borders with other countries in South America. And this is also another paper that is under review and is led by Dr. Victor Tardelli, who worked on the project and is now a postdoctoral fellow at University of Toronto in Canada. So we wanted to look at the trends in drug overdose mortality in the country using joint point regression models. But in this case, we wanted to report differences between regions of the country and border status within the country. And as you probably all know, like Brazil, being the largest country in South America, shares borders with almost all countries in South America, including Guyana, with the exception of Ecuador and Chile. So again, data came from the National Vital Statistics System, SIM data between 2000 and 2018. Our deaths were sorted by factors that only appear once on the death record, by age, race, sex, residence, year of death. And for this specific paper, we reported mortality rates for total overdose deaths in the country, in the region, or borders, calculating deaths by 100,000 inhabitants per year, using the same ICD-10 codes of underlying cause of deaths as the other original first paper. Again, we did joint point regression analysis, and in this case, like slopes were converted to annual percentage rates. So we estimated the annual change in each of the identified slopes. So showing a little bit some of our results. So when this graph shows a joint point regression graph of overdose death rates per 100,000 people between 2000 and 2018 in Brazil. And what we see here from this graph is that overdose death rates in Brazil range from 0.2 per 100,000 individuals in 2000, which corresponds to about like 350 people dying that year, to 0.82 per 100,000 people in 2018, corresponding to over 1,700 people dying by drug overdoses in 2018. And we see increases across time, like with two joint points, and different increasing trends across time. Then, as I mentioned earlier, we wanted to further explore whether there were different trends by regions of the country. And for those of you that might not be familiar with the country, like Brazil is divided in 5 different macro regions. So the northern region, the northeastern region, the central west region, the southeast region, and the southern region. And so we calculated mortality rates by overdoses for each of the regions, and also looked at trends over time for each of these regions. So this figure, I know it's busy, but it shows the overdose rates per 100,000 persons between 2000 and 2018 in these 5 Brazilian macro regions. So if you look specifically at the northern region, what we see is that it had low rates of overdose, like of 0.21 per 100,000 in 2000, which remained relatively flat up until 2010. But then there were steep increases from 2010 onwards, from 2010 onwards up until 2015-16, where we see that the overdose rates truly increased. When we look at the northeastern region, that is the one that is written here in Portuguese, Nordeste. I'm sorry, everything is in Portuguese in the graph. In this graph, I only realize now. It had an overdose death rate of 0.26 in 2000, which consistently increased across time up until 2018 was 0.55 per 100,000 individuals in 2018. When we look specifically at the center-west region, which is this red line, we also see a consistent increase in overdose deaths across time with no joint points, but it increased. The overdose deaths increased from 0.24 per 100,000 in 2000 to 0.99 per 100,000 in 2018. So both the northeastern and the center-west region had consistent significant increases in overdoses in this almost 20-year time period. And then when we looked at the southeastern region, which is Sudeste here, the southeastern region, we saw that it started with a lower overdose rate in 2000 of 0.16 per 100,000 individuals, but went up to 0.85 per 100,000 individuals. Yeah. So it increased significantly, particularly between 2000, particularly between 2000 and 2009. In the southern region, which is the line here that is first in red and in green, the overdose rates also started low at 0.20 per 100,000 in 2000, but they increased steeply by 2018 for 1.15 per 100,000 individuals. And there was a consistent upward trend between 2000 and 2010, and also an upward trend between 2010 and 2018. So we see increases that are different, but we see increases in overdoses among all 5 Brazilian macro regions in this almost 20-year period. Then we also did several different analyses looking at whether patterns of drug overdoses would be different according to the borders with other countries in South America, and we ended up with two different categorizations: a northern border, which included the Brazilian border with the Guyana, Suriname, Venezuela, Colombia, Peru, and Bolivia, and then a focus on the southern border, which includes the Brazil's border with Paraguay, Argentina, and Uruguay. And what we see here is that we see increases in overdose rates in the Brazilian northern border. So in 2000, the overdose rate was 0.21, 0.28 per 100,000 individuals, and by 2018 it was 0.85 per 100,000 individuals. So we see a significant increase, particularly between 2008 and 2016, and in the southern borders, overdose rates were different. They started on 0.22 per 100,000 individuals in 2000, and they were 1.12 in 2018, with a particular steep increase, with increases between 2000 and 2010, and then also in 2010 and 2018. So the patterns also are slightly different. So what does this all tell us? What does this all tell us? So the data from these two papers that I showed you today, they clearly show that the overdose death rates in Brazil have increased more than 4-fold between 2000 and 2018, representing about 16,040 deaths in 2018 compared to only about 410 overdose deaths in 2010 nationally in all regions. We know that in most of these overdose deaths occurred in men that were identified by the medical officers as non-white, and most of them were single. From the information that we have regarding intentionality, most of the drug overdose deaths were intentional, and more than 35% of them were categorized as suicide. And among the deaths in which we have information about the drug, T codes, cocaine is the most common substance in these overdose deaths. And we're now doing sub-analysis specifically focusing on cocaine and polysubstance use with cocaine. Interestingly, we see also an increase in drug overdose deaths in the population with higher educational attainment. And also, I think what is important to note, like from the second paper, is that overdose death rates in the borders are higher than death rates overdose death rates, national death rates and death rates like in different regions of the country. So as I mentioned earlier, the steepest increase in overdoses was in the southern region between 2010 and 2018, and the country borders have slightly higher overdose rates than national estimates, and we see variability in these overdose rates. So we see significant increases in the southern borders and some decreases in the borders with the Andean countries, Suriname and the Guyanas, and we hypothesize that different drug trafficking routes in these border areas could partially explain the increase in drug overdose deaths, particularly in the southern borders. Of course, the data that we have access to from Brazil is not without limitations. Yeah. The database that we had access to, it is a government database, but it is incomplete. It is incomplete. So, and it also like depends on the quality of the death certificate. So that is something that we are also checking. We know that the quality of the filling of the death certificates varies a lot by regions of the country. We also know that other factors related to death may influence data under analysis. And as I said earlier, very few of these death certificates, which can describe like specific drug involved in overdose, include ticket categories. And also we don't have information on whether like the medical officers or autopsies, whether they tested for multiple substances or not. Yeah. So one of the limitations is that there's also a high proportion of unspecified overdoses in the data, and we couldn't get further information on that. Yeah. So we believe that future research in Brazil needs to focus on evidence-based treatment and also harm reduction approaches, particularly for people that have crack cocaine use disorders, crack cocaine dependence, to prevent overdose deaths, particularly in the vulnerable border areas. And also most importantly, that the mortality data collection in the country as a whole needs to be improved so we can have more information about and more detailed information about drug specific mortality in the country. So I'd like to acknowledge internal Columbia funding for this project. It wouldn't be possible without this internal Columbia funding, and also all members of the research team here at Columbia, here at Unifesp, and now here at Columbia, at Unifesp in Brazil, and also now some of them are now based in Canada. Thank you.
I think we have time for maybe one or two questions. Does anyone have any questions from the audience? So I have a question actually. So what is the overlap, do you think, between these deaths that seem to not be categorized and these overdose stats and potential suicide attempts? Do you think there's some overlap with suicide?
Yes, so as you saw, like in the slides we presented, like we think that at least like the ones in which we have information, we know that more than 35% of them were categorized as suicide. Of course, like because there's stigma related to suicide, it could be that some of the other deaths were suicide, but were also suicide, but were classified as accidental. So as in other countries, like there is a lot of taboo and stigma associated with suicide in Brazil. So sometimes there might be like even pressure from family members to ask like the medical staff not to categorize to categorize the deaths as suicides. So that is also something that varies by city, by region, and that needs to be improved. But we believe there's a lot of overlap. Yeah.
Yeah. I was thinking that when you were presenting about the overlap. Yeah.
We're going to, like, we also now have a student looking specifically at cocaine and polysubstance death, and the ones that we have information, we know it's only a subset, but also looking into more details, like in whether these deaths were also whether there is overlap, like with suicidality codes, and also with other potential deaths of despair. Yeah.
Very interesting. Thank you so much for being with us today. Unless anyone else has any questions, we're going to switch to the next speaker.